Before I get started on any of the exercise videos, I just want to show you first how you can put on the BFR cuffs and check it with a Doppler ultrasound, because it's actually pretty easy, but people are intimidated by it. Now, I'm doing this on myself, and that makes it much more difficult. Ideally, you'll have your athlete lying completely supine, and it's much easier that way. For the lower extremity, first you have to find the posterior tibial artery, and then once you find it by hand, you then put some jelly on it. Turn on your ultrasound, and you first got to find it. I actually found that if you put a little bit of pressure in the cuff, it's a little easier. Next, you just pump up the cuff slowly until that pulse goes away. And once I find that spot where it goes away, I then slowly let pressure out to make sure it comes back. That's my way of double checking. It's the same process in the upper extremity. Now here you're just palpating and finding the radial artery. And same thing, have that cuff all the way cinched up as far as you can towards the joint. Get it nice and tight. Palpate the artery, pump up the cuff, and listen for that pulse to disappear. Once you have that, that's your total occlusion pressure. And then that's where you take your percentages for exercise. Don't forget to add some jelly because that'll make it much easier to find that artery with the ultrasound. Also, it's going to be a lot harder for me doing it because I'm doing it on myself. So the hand that I'm trying to find the pulse on and monitor it is the same hand that's pumping. So it's much easier than this when you're doing it on somebody else. This last week, a lot of people talked about their quad dominant athletes, and that's the reason that they don't have good mechanics. And I'd say majority of the time is they don't have good mechanics because they haven't been taught good mechanics, especially in this population. They just haven't been taught how to do it, and they have these new bodies with longer lever arms than they're used to, so they have to relearn. So this is a great way of doing it, and I'm going to show you a lot of different exercises. While I'm on the subject of quad dominance, if somebody truly is quad dominant, and it's not just a movement pattern that they need to be taught, I wouldn't say that the quad's the issue. I hate when people say, oh, they're quad dominant and the problem is the quad. I'd rather that call them, hamstring or posterior chain deficient. That way it puts the emphasis on what needs to be brought up to standard, not just saying, oh, your quads are overly strong. So that's my 2 cents on quad dominance, and that I hate that term. The reality is, if you can use either this exercise or some of the other ones you're going to see coming up, if you can train somebody out of a bad movement pattern, it was the result of neuromuscular control and learning how to do it, not a quad dominant or a hamstring posterior chain deficiency. So make sure you're looking at the mechanics, before you go right to the dominance. And the only way to tell if somebody is dominant, truly, dominant or deficient, is by getting an isokinetic test. That's the only true way. All right, next up is an exercise that I use when I'm teaching somebody how to use a proper hip hinge, or when they're just learning how to squat and I'm noticing they're getting a lot of lumbar movement. This is a key exercise, and you can even have this be a higher up, like a chair with some pillows in it, or even doing it onto a wall. As long as they learn to keep that spine stable when they go. And the key is to put, a broomstick, or any stick that you have, a dowel. One end goes right on the base of the sacrum, and the other goes up. And you have to keep it on your sacrum, the upper back, and the head the entire time. Next up, this is one of my athletes I'm currently working with. She's about 5 months out of an ACL reconstruction. She completed physical therapy formally in a clinic, and now I'm working with her to get her back to return to play. Now, she had the quadriceps tendon used as the graft, and she has a lot of quad weakness still. We just kind of started working together. Before she started with me, extremely weak in her quad. So one thing I just want you to pick up on is the angle that her tibia makes versus the angle that her trunk makes. Um, we would like those two to be parallel. And when somebody who has true weakness in their quadriceps, um, they have to overutilize their trunk and posterior chain in order to make up for that. Because she's going to try to squat as low as she can, but she's going to make up for it. So the knee is going to stop bending, and she's going to get more motion out of the hip and the trunk. So this is just one exercise I like to use to get her down further than she could go naturally, to help see if we can improve that squat depth. I call this exercise the bottom up squat, because we're going to use something to help her get into the bottom of the squat. It can be a bar, it can be a doorknob, it can be a TRX. When she gets down there, we're then going to have her kind of shift forward into the true squatting position. I'm going to have her engage her lower back, her upper back, her glutes, let go of whatever she's holding on to, try to bring her arms up, and then stand up. And this is one of the high school kids I worked with over the summer, and he had good squat mechanics until you put a load on. So this is just showing bottom up squats in a squat rack. This is a great one to use because it helps them to get into a lower position and engage before they come up. And then what you're hoping is that once they learn it, then you'll see it when it's reversed, when they start in the upper position, and then they can continue to hold that good engaged position all the way through the bottom. Now, you can't do this on a Smith machine. You just can't, because the Smith machine is fixed in place. It doesn't allow that forward and back movement. You can't do it. So you need to have a squat rack that is going to allow them to hold the weight in that down position, and then give them a little bit of a guide without them riding the bar along that guide. Next up is the reverse wall squat, and the key to this is to try to get them as close to the wall as they can possibly go. And then I like to put the hands behind the head. That's going to expose any thoracic spine issues that they have, any issues with extension there. And then as they lower down, they can't hit the wall. So this is going to not allow them to overutilize the, if they truly are using like a knee pattern where their knees are going forward. It's not going to allow them to get that big forward trunk lean, and it's going to make them engage the thoracic spine. Next up is a unilateral loaded front squat. Now, any front squat or goblet squat is going to help with the mechanics, because that weight being in the front allows them to sit back further into the squat. So you're going to get a much better squat form. I just didn't want to spend time showing you a basic goblet squat, but I highly recommend using a goblet squat to help encourage the proper form. Here I'm doing a unilateral loaded front squat, because that's really going to kick in a ton of neuromuscular learning for the body. It's loading them in it's really hitting that frontal plane. So it's going to really challenge their hips, their knees, to try to stay nice and balanced. there's a huge core element to this. That's why you see my arm sticking out to the side, just trying to keep myself balanced. Now, you want to go heavy enough to where it throws them off, but not so heavy that they can't get a full, proper squat with good form. If anybody hasn't seen this next exercise, it's an oldie but a goodie. It's a banded single leg squat. So you want the band to be pulling that involved knee into a valgus position. And this is actually done really well with sliders. Just sliders don't work on my rubber floor. But if you have a floor that you can have that back leg on a slider, that's even better. You want them to be able to get as deep into the squat as they can. And you want to have that band nice and heavily loaded, but not so heavy that they're just leaning into it or they're not able to control that valgus knee. Now, this is a different way of accomplishing the same thing. So in this version, instead of the band being around the knee, you're wrapping that band around the body. And you need to have it to where it's pulling, rotating your body toward the stance leg. It's going to give you the same mechanism, the femoral adduction with internal rotation. But doing it this way, it's twisting you from the top down, and it's much more realistic to the forces that they're going to see. So if you can do this exercise this way, it's much better. And this is actually pretty tough for me. I had to make it a little bit easier just so I could do it without leaning. Next up is just a single leg sit down squat. And this is just a progression of a step down. When we're on a 2-inch step, we then need to go like a 6-inch step. Well, there comes a point where your step's not big enough. So what you need to do is use a chair with some pillows, eventually get them to go right into a chair or onto a bench. Everybody progresses their athletes with increasing the load. Well, a great way of increasing the squat is just by getting that depth. So, they might be able to do a single leg squat or a step down with a light weight, but the moment you increase that depth, you have to get rid of the weight or make it lighter. So increasing your athlete's depth is an awesome way to make them go further in their rehab versus just adding a load to it. Now, if you notice on this leg, I'm doing the concentric and eccentric, but when I did the first leg, I was doing an eccentric only. So I would lower myself down with one leg and then use the other leg to get me back up. So one way to progress this is just by going from that eccentric only, then into the eccentric concentric. Next up is a banded split squat. Now, I love the split squat in general, especially if you have somebody who's having difficulty getting a good squat depth, or if they're having any knee pain. I like to use a split squat. I'm not big on using the Bulgarian split squat where that rear foot is elevated. But this variation here, I have the band set to pull them into that frontal plane. So it really kicks in the hip abductors, the external rotators, as well as the adductor on that other leg. Really brings in a much higher level of difficulty and engages those hips. Next up, I want to show you using this device I bought called the Monkey Feet. Now you can do these next two exercises with a cuff weight. Problem with cuff weights is they usually only go about up to 5 pounds. And they also like to slide up the leg. But this device called the Monkey Feet, it can hook into as heavy as a 160-pound dumbbell. In this video, I'm just using a 20-pounder, and I usually use up to 40 pounds when I do it. Whether you use the Monkey Feet or a cuff weight, either way, when you're doing the terminal knee extension, the key with this one is to get them in the supine position. If we do it just sitting up, when they extend that knee out straight, the lever arm is at its longest. That's the first point. So that weight's going to be heaviest when that knee is all the way straight. The second point, you're actually weakest when your knee is all the way straight. That's why our isokinetic curves look that way, because you're weaker out there because, again, it's a longer lever arm, and two, you don't have a good mechanical advantage and you don't have a lot of cross bridging. The third reason is that when you're all the way straight, especially somebody who needs help with their quad, that's where they're going to have the hardest time activating that quad, is in that terminal extension, especially if it's a new area of motion to them. The third point, when you're in that, or a third or fourth, I've lost count, you're going to have the most tibial shearing when that knee is extended. And if you're doing any kind of open chain, typically your first 6 weeks, we're not really allowing you to go beyond 30 degrees. But even after you pass that 6 week point, as you're going heavier and heavier, you don't want to just load that tibial, that anterior tibia aggressively on the ACL. Last point, I can only do 0 to 90 if I'm doing this in the sitting position. So if I have them do it in the supine position, it's allowing me, one, a bigger range of motion, because now I can go beyond 90 or 70 degrees. So a much bigger range of motion. Two, when the weight is parallel, that's when I'm at 90 degrees. Now I'm much stronger in 90 degrees. Actually, the point where you're the strongest in the isokinetic curve is about 70 degrees. So I can load a heavier weight because where I'm stronger, I can handle that heavier weight. But now as my knee goes to extend, as that muscle's getting weaker, the weight is actually becoming a little bit lighter, which is really good because as I hit that weak point, I don't have to accommodate to a lighter weight. I'm going to get less tibial shearing at that point because the weight is lighter as I'm going into that terminal knee extension. So whether you're using the monkey feet or just a a cuff weight, do your full arc quad in the supine position if they have the range of motion for it. You're going to get so much more out of it. Next up is the hamstring curl, and the same thing. You see people doing this all the time in standing, but for the exact same reasons that I just mentioned with the quad, you should do this in in prone. The hamstring is actually at its strongest when that knee is out straight. If we were to take, the concentric eccentric strength curve, if you just look at a hamstring concentric curve, it looks like it's actually weaker as it extends. That's just because it's catching up to the machine. But that's a conversation for another day. So the hamstring's strongest when that knee is extended. So you'll get the most benefit out of it with the prone position because as the knee goes towards extension, the lever arm gets longer, so it's hitting it harder there. The only thing to keep in mind with this one is, if they are having issues with full extension or extreme weakness there, or they are very hypermobile and they're going into hyperextension, have them do this on the floor. That way the foot will stop them from going to that full extended position. You also have to be careful as the knee flexes. If they go beyond 90, that weight's going to want to bend the knee further toward the hamstring. So just keep in mind that they're in control of the weight. Next up, I want to show you some bridge variations. And anytime I'm doing a bridge, even if it's just a simple basic bridge, I always have the athlete dorsiflex the ankle. You're going to get a bigger hamstring and glute activation and a little bit less quad when you do that. So I always have them lift the toes and dorsiflex the ankle. This next one, I have bridge kicks and kick holds. So the key with this is that they're going to maintain that stable position while they're kicking back and forth. And I don't let the femurs rise up. You want to keep them level. You can either go back and forth or you can have them hold it for 5 or 10 seconds at a time. And I like to have them hold because that really helps with stabilization. Next up is a bridge hip dip. And the key with this is they bridge up, kick one leg out, hold it, and then they're going to rotate the pelvis down to the floor and then back up. So you're not really working on the just the hamstring and the glute here. You're working on all the hip stabilizers, internal, external rotators. Really important exercise for them. Next up is just a unilateral or a single leg bridge. And all these variations I'm showing you, they're not just great for people with hamstring weakness or hamstring tears. I love using these with all of my low back pain patients, SI joint dysfunction. If you get an athlete with SI joint dysfunction and you need to work on stabilizing and controlling the pelvis with those glutes and the hip stabilizers, these are great exercises for them as well. So this one is just a basic single leg bridge. It's more challenging than just some of the other ones. The key is to get that full extension all the way through on the leg that's actually bridging and try to get them not just going to neutral if you can. This next one is called the runner's bridge, and this is great because it's extremely functional. Whenever we're sprinting or really running, the leg that's behind us in extension, the pelvis on that side is in an anterior pelvic tilt, whereas the pelvis on the opposite side, with the hip flexed, it's going to be in that posterior pelvic tilt. So you're not just fighting the weight of the body with this exercise. You're also fighting a big issue of the pelvis having to control that natural back and forth motion. So this is a really good one. The key is to when you pull the knee back to your chest when you're first starting, pull it back far enough to where you feel the pelvis on that side go into that posterior pelvic tilt, and then keep it in that the whole time. And what you'll see with people that have difficulty separating the two halves of the pelvis is that as they bridge up, they either can't get into a full extended position, especially past neutral, or the leg that they're pulling toward their chest is going to be creeping forward. And you can actually see it trying to creep forward because they're not able to control that. So, this is a great exercise for, again, anybody with hamstring issues. It's great for any low back, SI joint, hip dysfunction. But this is a really good performance exercise too, because if you can improve their ability to separate the pelvis and get that power in their hip extension in that position, it's a great exercise for them. This next one is slider bridge, and the key with this is it's pretty advanced, and you're trying to go for time. Now you can go really slow, like I am initially, or you can have them go nice and fast. I typically try to have them first start for like being able to do it for 20 seconds, and then 30, and then 40 seconds, or to try to get a certain number of reps out of it. So this is great for the endurance. This next one is Swiss ball curls, and you could certainly do bridges on a ball. I actually like to have people do bridges from a chair with their feet on the chair, and then they do the bridges on the ball. But pretty basic. I didn't want to show that. So the key with it, and the issue I see most of the time is that as they curl back, they're getting a lot of hip flexion. If they have the strength for it, try to keep them in a hip neutral position. So you actually see the hips and the pelvis rise along with the trunk and the knees as they go up. If they're able to do it, it's much more challenging, but it's a great advancement. Now, when they first start it, they're not going to be able to. Their pelvis will be nice and close to the floor, and you'll see that hip flexion with the knee flexion. But again, as a way to advance, just have them bring the pelvis up with the ball. And my last bridge variation is just a single leg Swiss ball curl. This next exercise is a series of yoga poses that I do as a yoga flow. So the first one is Warrior One. And the key with all these is, you hold each position for about 5 to 10 seconds. And I want them to take about 5 seconds to transition because it's not just about the pose itself. It's about the transition, the quality of movement and control going from one position to the next. This next exercise is just another way of doing terminal knee extensions that's a little bit different. I really like doing it this way versus in supine. Um, with the bolster underneath the knee. I like to put the bolster near the ankle and prone. I feel like they just get a better contraction out of it, and they're much more successful. It's also going to eliminate too much of the glute and hamstring taking over because they have to keep their leg on the bolster. So try your TKEs in this position sometime. So next, I just want to go on a rant about a couple exercises that I see being done wrong all the time. And the first is the sideline hip abduction. All the time I see the athlete performing it, they're lifting the leg up, but they're also bringing it forward into flexion. And all that's doing is making your tensor fascia lata extremely strong and dominant. And it's not really hitting your glute very aggressively. You'll see the correction I make here. The hip has to come into extension with external rotation. Here, I'm starting with my leg neutral in the down position, but I've even had it before where I have them bring their leg actually down into flexion so that way they can overextend when they come up and externally rotate. So if you're finding that your athlete later on down the road is having problems with glute strength and even just activating the glutes, it's because you never taught them how to use the glutes early in their rehab. So make sure they're doing the sideline hip abduction correctly. Next up is a banded side step, and initially I'm doing this the correct way, the way that I want it to be seen or done, but then I'll show you the mistakes. So the mistakes I see are initially that the person will counter lean. So when they're stepping toward the right, they lean to the left, and they basically just stack the hip joint. And that's going to make it so that the hip abductor doesn't have to work so hard. So make sure that they're not getting a counter lean. So the moment they go to make a step, they're actually abducting and separating and moving toward that side. Another mistake I see is when we put the band at the ankles. There's nothing wrong with having the band at the ankles. It's good. It gives you a longer lever arm. You get more separation on the band. But the problem is I see the patient will internally rotate the foot and reach as they abduct. So they're really kind of internally rotating and extending. So they're basically leading with the foot versus leading with a vertical tibia. So there's nothing wrong with having it at the foot so long as you're not allowing them to internally rotate at the hip and extend to get there. And lots of times you'll see this done in conjunction with that counter lean. This is me showing you a good cue that I like to use. I essentially just have them externally rotate the shoulders at the same time that they're stepping, and you can even give them a really light band to do it with. For some reason, when they do that same upper extremity external rotation, it makes them activate the muscles correctly in the lower extremity. All right, next up, I just wanted to show you really quickly when I'm training some of my athletes, even if they're not injured, I like to use circuit training, but with my injuries too, as they're getting ready for return to sport, we're trying to work on full body strengthening, conditioning. I like to do circuit training. So for her, this circuit, she's doing 10 split squats on each leg, and I cut it down that way you're not watching the entire circuit. So she's going to do 10 split squats, goblet from each leg. Then she's going to go to inverted rows. And then after she does 10 inverted rows, she's then going to go to 10 sumo deadlifts. What I like to do is try to combine upper body pushes, upper body pulls, a squat pattern, a hip hinge pattern, something that's bilateral, so the whole body working, things that are unilateral, just half the body or a split stance. And I like to also combine carries and functional core all at once with very little rest. That's just my style of training, especially as we're trying to get our athletes back to a level of athleticism versus having them do one exercise at a time. I really like to combine it. In this next circuit, she's doing curl presses, 10 each, and then she's going to go into 10 front squats, and then she's going to go into a renegade row, 5 per arm. Now, also this day, we started with some a warm-up, some movement correction. We did a retro walk on the treadmill. We did a very short walk jog. She did a lot of agility ladder and some very beginning plyometrics. We did a couple of these circuits. She did isolation step downs for her quad, and I also had her do some isolation core work. Next, I want to show you a flex bar progression, and it's going to start with 4-weight isometrics. Now, these are great for right after a elbow or shoulder surgery. If you've had a real bad elbow sprain, any strains to the musculature, so anybody that had, with a Tommy John's, or if they just had, a strain to that medial elbow, anybody with a wrist injury, whether it's a TFCC or like you'll see in high school, middle school, a lot of wrist hyperextensions or sprains, these are great for them. These are also huge for any baseball player if they had a shoulder surgery. Anything that's going to make that wrist forearm musculature atrophy, you got to get them on this right away. Next is just an active version of each of these. So now the left arm is going to be doing radial and ulnar deviation, as well as supination and pronation. Next is the Tyler twist and the reverse Tyler twist. This first one is just putting the musculature in a shortened position, loading it with the flex bar, and then lengthening it underneath tension. So it's a big eccentric load to the wrist flexor mass, huge for any of your pitchers, especially after a Tommy John injury. And this one is the reverse Tyler twist, and it's the same thing, but except for the extensors. So we're putting them in a shortened position, loading it with the flex bar, and then lengthening the muscle under resistance. Next, I'm showing you a way to use a blood pressure cuff for any 4-way shoulder isometrics after surgery or a big injury. What I'm doing is I'm pumping up the blood pressure cuff, and I have a little 3-pound weight sitting on it. And I'm wanting to have it to where when I put that 3-pound weight on it, the pressure gauge comes right up to that 20. So now anytime I push on it and that pressure comes up to 20, I know exactly how much pressure I'm getting and how much pressure the patient's getting. So it's a great feedback device. And then all you're going to do is include this with a normal 4-way shoulder isometric. So when they push forward or backwards into extension or internal or external rotation, they're watching that little pressure gauge. This is a way that you can monitor your patient. Lots of times they'll do it in the clinic and they do well, and then they go home and they do it and they tell you that it hurt after. And it's probably because they're pushing too hard. So this is a way of kind of keeping them in check and not letting them push too hard. So when they do flexion and an extension, they're going to be a lot stronger. It'll be easier. You might allow them up to 5 pounds. But for internal and external rotation, it's much harder to hit that 3 pounds of pressure. Next up, I have banded, reactive, 4-way shoulder isometric. And the key with this is that they first load the band under no tension, pull those shoulder blades back, and then step forward. And they're not going to allow that arm to go back. You're going to do the same thing with extension. Again, start them in neutral position under no tension. And when then they step back, don't let that arm go forward. And it'll be the same thing for internal and external rotation. They don't allow the arm to move out of that position as the band loads it. And this is better than just pushing into a wall, because now the shoulder first has to sense how much pressure it's being loaded on it. And then they have to match that same amount of load at the muscle in real time. So it's much better for a neurologic adaptation and for getting those muscles firing early on. Another thing to watch for is as they return to that start position when the tension goes away, don't allow that arm to move even then. So they have to learn how to relax the muscle at the same time. So now we have the exact same thing, but we're going to do overhead positions. So flexion, extension, and then ER and IR at 90 degrees. Now you're going to do these when the patient is allowed to start. Really, it's before they start exercising actively overhead. So they've been allowed to have active motion, and now you want to start engaging the muscles, but you want to do it safely in an isometric manner. So you're going to do this again after overhead motion, active range of motion is allowed, but before you're going to do any resistance or any stability work up there. So this next exercise is just an eccentric banded external rotation. So you can do the concentric portion under either no load or very little load, and then step away, which is going to put a bigger load on that band, and then slowly perform the eccentric contraction. And you can also do this in the overhead or the 90-90 throwing position as well. Last up is one of my favorite exercises. So this is a variation on the traditional Blackburn T and Y exercise. Once they're able to do it off the table, I like to get them into a quadruped position, and they do the exact same exercise, just one arm at a time. Just make sure they're in a good position, full external rotation. So they're going to do both the T or just pure abduction. They're also going to do the Y position, which is about 135 degrees up. Now, not only do I like to do these from a quadruped position, but I really like to take them into a bird dog. Because once you bring them into a bird dog, you bring in another element of instability. It's just going to engage the core, the hip, the shoulder, the scapular muscles to a much greater extent. So, this is how I like to have them do it if they're able to. This last one is a dynamic Blackburn. So they start in the I position. Then you got to get them to get a good posterior tilt, engage the thoracic spine and the scapula. And they're going to bring it all the way forward, touch fingertips at the top, and then bring it right back. And the key with this is you want to remain in that externally rotated position as long as possible.